Thank you all very much for joining us today. As our region continues to face the many public health challenges resulting from COVID-19, along with the economic hardships, we must also acknowledge we have a long way to go to ensure our communities attain economic and social equity. And doing so must be a core part of our efforts to renew and grow our economy in the weeks, months, and years ahead. And we look forward to doing so. In today's discussion, our guests will present specific tools and plans that will help businesses and other organizations work through the various aspects and phases of the regional reopening plans. There's so many different elements involved here, and these efforts will take some time and significant collaboration to work through everything. So we're really fortunate to have with us today the team that developed the Rosslyn Ready program. We really appreciate the Rosslyn BID for its willingness to join and discuss this plan and make it available across our region. These are specific tools that will be very helpful to individual companies and organizations as they work through reopening. If you have any questions, please use the Q&A box at the bottom of your screen, and we'll get to as many of those as possible. Also, this session will be recorded and shared on our website later this week. And so now I'm going to turn it over to Mary Claire, president of the Rosslyn BID, to introduce our guests and get our conversation started. So with that, Mary Claire, thank you.
Great. Thank you, Jack. Thank you so much for having us today. So I thought I would start by just sharing a little bit of a context around this Rosslyn Ready program. Really, this started because through our interactions that we were having with our businesses, we really heard that the current level of uncertainty, as well as how quickly guidance continued to change, really was making the task of planning for reopening daunting and in fact a little overwhelming. And so we decided that really the best way we could support them was to bring together experts across a variety of expertise areas and really help them think about reentry, both on the business side and the restaurant operators as well. And so really the goal was to help them create customized reentry plans that they could feel confident in executing. The Rosslyn Ready program actually is a very holistic program. It's a coordinated reentry effort that's between the BID, our property owners, our commercial tenants, our restaurants in Arlington County. And so really the idea is that each one of us has a role to play in reentry and doing so safely. And we wanted to make sure that everyone had those tools available for them. So for example, our organization is taking care of the public realm. And with Hellman Consulting, we have established a very important cleaning protocol for all of the public spaces. We also coordinated with our property owners. They're all doing amazing work getting the buildings ready, and they've been just a great partner with us in giving us access to their tenants and sort of all of us communicating together. And then so that left the commercial tenants and the retailers, specifically the restaurants. And so we wanted to make sure to get them what they needed as well. And so that's really a key piece of the program, and that's what we're going to share with you today. We brought together experts from Gensler, StreetSense, Hellman, and Bean Kinney Corman to really create a very holistic guide to help our operators and our businesses think about the reopening process. One thing I think that is really important to note is that one size does not fit all. Every business is different sizes, different layouts, different cultures. And so really the way we approach this toolkit is it's less of a checklist like 1, 2, 3, and more of a things to think about as you're kind of pulling your program together. Really, again, we wanted the business community to just feel more comfortable in this new situation. So with that, we're going to jump right into it. And I'd love to introduce our all-star panel of experts. And together, we're going to walk you through the key considerations as they relate to 4 topic areas. So people, place, policy, and perception. And hopefully that helps you get prepared to get back to work, whether that's an office or a restaurant. So from global architecture and workplace design firm Gensler, we have Janet Pogue McLaurin, who's a leader in Gensler's global workplace and research practice. Jay Coldren joins us from retail strategy firm StreetSense, and he is the managing director of the Eat Drink team, and he's a specialist in providing our restaurants with concept development as well as implementation. We have industrial hygienist Hellman Consulting on board, and Henry Hellman is the director of disaster services, and he's here to offer advice on protecting the health and safety of your workforce. And last but certainly not least, we have law firm Bean Kinney Corman. And Mark Vianney will be offering advice to navigate the changing world of employment, regulation, and other considerations. So we're going to jump right in. Let's start with people. Obviously, I think they're the most important thing here, and they are at the center of all of this. Janet, Gensler recently released a 2020 work from home survey, and to me, the results were fascinating. 74% of respondents said that they missed people the most because of working from home. But then 73% said that they want an increase in social distancing when they get back to the office. So how do you find the right balance between giving people that experience that they want and keeping them safe through social distancing?
That's a great question, Mary Claire. So let me kind of unpack it. And I'll post the findings of this survey and the insights on our website and in the chat box. But, we found that the workplace still matters, and it may matter even more. The longer we work from home and we're apart from our colleagues, the more being together matters. And we did find 74% of people said they missed their colleagues. We yearn for that shared work experience and that interaction. People said they missed meeting with colleagues. They missed socializing with each other. They missed those impromptu connections in the hallways when they, just from the mere fact of being in the same place at the same time and the natural learning and coaching that goes along with it. And they miss being part of a community. And those were the 4 top key reasons. So as employers, we need to think about how to create spaces where our staff feel safe, healthy, and empowered, and come together safely to be together once again. And, what we also found is most people want to come back to the office, but they expect some changes. And one of those key changes was increased physical distancing, as well as reducing shared workspaces. So the who comes back and when they come back can really be a part of that, overall solution. And what we're finding is, people are going to be coming back in phases, in staggered hours, maybe even in different shifts. And that will help have fewer people in the office to create that physical distancing that we really need. And I think even coming together for those in-house meetings are going to look and feel very different. We know that people are also asking to work from home part-time, or some people want the ability to work from home part-time. And so use that to your advantage as you start thinking about who comes back, when you do have meetings, who's in the room, who's virtual collaboration. Maybe they're doing it from their desk, maybe they're even doing it from home. And we've got to think through that in light of how we start to kind of come back together and be back together once again.
Yeah, all important considerations. We've had conversations with several of the businesses in Rosslyn, and that's exactly, Janet, what they're telling us is they're already thinking through, team by team, when to bring people in the office so that you don't have kind of everyone there at the same time. So I think that makes a lot of sense. One of the things I think that's been really tough, Jay, is that restaurants have always been gathering places for people. And I think that's, culturally, that's, is never more true than now. And I think the restaurants are a critical place for our business interactions, business lunches. So with the social distancing guidelines, this is going to be challenging. So talk to us about some of the creative strategies that you're helping operators to think about as they pivot in this new normal.
Certainly. Thanks, Mary Claire, and thanks for having us. God, I miss restaurants. I mean, I miss going out. I think we'd all say that it's the stage where we, in many cases, live really important moments in our lives. Yeah. And this feeling of connection is really strong. And we're seeing as restaurants reopen, there is this really big pent up demand to get back into the world and to get back into the routine and to experience the things that we miss about the restaurants, the connection and the energy and all of that. But, again, to Janet's point, people are scared and they're not going to be able to do what they did 4 months ago or 3 months ago right away. And so what we're seeing in the restaurant community is an incredible amount of creativity and innovation. I think Founding Farmers did an amazing job with their grocery program where you can call in and have, curbside groceries done. That's terrific. I've had dinner at Seven Reasons and Rose's Luxury, which were never able to get in before. Unfortunately, it was curbside and had to eat it at home. But restaurants are innovating with curbside. They're doing pickup, delivery, new delivery mechanisms, take out, take it home, family meals. There's a lot of creativity. But the thing to remember is that restaurants are only making about 20% or 25% of their pre-COVID revenue, and they need as much support and as much patronage and as much help as they can. Now, when they're able to open up again, they're going to do everything they can to get back on the horse and serve guests as quickly, but they need help and they need support, and they need longer hours and more flexibility from the community.
Yeah, and I think that's an important thing that we're seeing. We're certainly working with our local government to try to figure out some of those pieces. And I'd be remiss to not obviously mention some of the unrest that's happening across our nation. And obviously that's, yet another impediment for our restaurants, because many of them, at least in Virginia, had just gotten the okay to start to that reopening process. So obviously our hearts and prayers are out to all of them, and hope that that comes to a quick resolution, because that's obviously more gas on the fire, which is challenging. So Mark, when we're thinking about the people side of this equation, reentry procedures are things like wearing masks and taking temperatures and ensuring that the employees can kind of keep enough distance between themselves. I know I've had the question, what exactly can I ask my employees to do legally? And what do I do if an employee doesn't seem to want to comply with those new protocols that I've put in place?
I guess, first of all, it's important to remember, the focus is going to be, you're dealing with COVID-19. So, you've got to come up with a policy, and we'll get into that a little bit later on, implementing workplaces and narrowly tailored to what you're actually doing with your work and people's exposure. But as part of that, you're going to be, surveying your employees about, either their health, in terms of health being issues narrowly restricted to COVID-19. Are they displaying symptoms of COVID-19? If you're using a thermal scanner, take people's temperature when they're coming into work, that information, and then, if they've had exposure to someone maybe at home who's got COVID-19. It's not a license to go into this broad fishing expedition about people's health. It's narrowly tailored to COVID-19 symptoms and exposure to COVID-19. When you do establish your policy on this, and we'll talk about a little further, is you're having someone who's not abiding by the policy. Remember, the policy is there, no different than any other safety or security policy your company, your workplace may enact. And you have to treat it the same way. If you have someone who's not abiding by it, you have to document it and use kind of the standard progressive discipline system. That could be up to and including termination. But treat it as if you would treat any other violation of your otherwise established company policies, and keep yourself well documented, and that should be it.
Yeah, and I think that's it's figuring out what's policy and what's guideline, and just making that super clear, I think is important. Henry, turning to the cleaning side of this equation, when you're talking about people, obviously personal hygiene and having employees wash their hands is so critically important. But what other sanitation procedures do you think are most critical for folks to be following?
Yeah, so thank you, Mary Claire. Obviously, employee hygiene and the social distancing are the #1 tools to prevent the spread of this disease. So you want to think about everything from the parking lot to the elevators. How do people enter and exit the building? And jumping off policy, you want to make sure that people understand these things. So doing trainings with your people before they come in, so that they understand how to move through the building, how to use the restrooms. Then you want to start thinking about areas like, are you going to use your copy machines? Are you going to have sanitation wipes there so they can wipe that down? How are you going to use your conference rooms? Are you going to use them at all? Are you going to use the pantry? I know coffee is a hot topic for a lot of people. Do you want to use a shared coffee machine? That increases the risk, but at the same time, you want your people pepped up so they can work. So just going through those things, and then making sure you have enough supplies. So do you have sanitation stations? Do you have wipes at people's desks? Do you have everything that people need in order to feel safe while they're in this office space?
Yeah, those are all great tips. And I think I put a link in the chat feature that has a link to the toolkit. So if you haven't seen it yet, by all means, go ahead and download it. There are two versions. There's one that's specifically tailored to the restaurant operators, and then there's one that is tailored to office. And there's a really comprehensive guide that Henry created for us that really kind of goes through your checklist of how to walk through the space, how to think about that. And actually that's a great segue to the place, right? So clearly the physical changes that need to happen to accommodate the new guidelines and keep people safe. Janet, when I think about Rosslyn, for example, the variety of office types and buildings or businesses that are in our buildings, reentry is going to look very different, for a company like Nestle, who's very large, to someone like our office, which we only have 12 people, for example. So how should businesses really approach that physical space? How do they, do they start looking at the numbers of employees, the office layout, shared spaces? How do you start to crack that?
Well, I'd first start with your tenant space, and this is going to be different for every single person. If you're a large company like Nestle, you may be looking at the whole building and how they enter the building and how they get to Nestle space. If you're a smaller tenant, you're more concerned about what happens from your door entry and through your workspace. But then once you've got that thought through, coordinated efforts and talking with your landlord about what coordinated efforts along with all the other tenants that you might be able to do to make it a better experience, because this is all about a human experience. Just think about it as a technical checklist, but how can you make your employees feel better and yet solicit, create as safe as an environment as possible and really encourage the right behaviors. So I would start with your entry. Look at where are you going to allow visitors, or they come much later in the process? How do employees come through? Are you going to do any kind of check with employees as they start to enter the space? How do you start to, do you need queuing in your lobby? Do you need to spread out chairs in order to get enough physical distancing between? And then how do you start to navigate the office? Look at your corridors and hallways. Are they wide enough to have 6-foot distancing, or do you need to start considering one-way corridors? Can you even use the fire stairs between your floors if you're multi-tenant, in which case they also need to be thought through as one way? Now, how do you start thinking about how do you get to your individual offices or workstations? And is there enough physical separation? You may have to actually de-densify, which is a new word that we've started utilizing in these strange times, because some of the workstations actually got very small over time. So is there enough physical distancing, even between people that may be facing each other? And do you need to consider panels or deactivating some of those stations, which actually with the phasing and bringing back people on a smaller basis over time may actually help, because you've got now the ability to spread out. But don't forget all the shared spaces like conference rooms. Even sitting around a conference table isn't going to be the same, and you need to make sure that you've got enough physical distancing. And maybe a conference room that sat 6 or 8 people may only have 2 or 3 now, in terms of being able to get enough space between people and encouraging virtual collaboration. And then lastly, start to think about all those things like Henry mentioned that you're touching. And can you start to prop doors open? Can you start to remove things, make things a little bit easier to navigate the office? So you could start with looking at a floor plan, and then just mentally start walking through. And then with that first wave starts to come back, pay attention to where all those decision points are. That may be where you've got signage and other cues to help remind you. Like you may actually need to do 6-foot queuing to get to the restrooms. Because think about it, you may need to activate only every other stall in the short term. And so thinking about how you start to move throughout your office space throughout the day, both shared public areas as well as within your tenant space will go a long way toward creating a work environment that does start to have those elements addressed.
Yeah, and kind of moving on to the restaurant side of the equation, what can we expect to see, Jay, in terms of physical changes that are going to keep us safe in a restaurant?
Yeah, and depending on your jurisdictions, Mary Claire, right now I think Virginia is at 50% outside seating only, no inside seating. The district is at a certain percentage, I think it's 25% inside seating and some outside. You're going to see a lot of tables marked off. You're going to see a lot of space between tables, and you're going to see a lot of, I would say plexiglass barriers and things, or antimicrobial, curtains and things between tables to get the kind of capacity that allow these restaurants to function and make money. The thing to keep in mind is that at 25% capacity or 50% capacity, restaurants are still losing money. And they make money on the last 15% of their business on a busy night. So they're still losing money. And so they're through delivery, and you'll see, I think, pickup lanes and, special areas for delivery. And I also think you're going to see the bar turn into much more of a pickup station or a grab and go kind of situation in a lot of places, because, a lot of jurisdictions haven't allowed bars to even open for business yet. So it's a very different experience. And you're also going to see a little bit lower touch, higher anticipatory service, less touches to the table, more QR codes on the table in lieu of menus, QR payments, touchless payments, things like that, pre-payments in some cases. So you're going to see a very different experience. It's going to be a lot lower touch and a lot more sterile, a lot more sanitation forward.
And speaking of sanitation, that's a perfect lead into you, Henry. So I think, one of the things that, Janet touched upon is, as you're re-entering the space, having the hand wipe, dispensers and the washing, hand washing stations in place. But if you haven't been occupied in your space and that space has been unoccupied for a while, how are you advising people to get that ready for re-entry?
Yeah, that's a great question. You have to remember, these buildings and these spaces were designed to operate, and they've been sitting vacant or partially vacant for quite a while now. So there's a couple things you want to look at. I mean, your building is definitely looking at all of these things. The water systems, they've been sitting stagnant. So stagnant water creates this great environment for bacteria to grow. And specifically, Legionella is a huge concern right now. So a lot of building operators are going around, they're doing an extensive flush of their system. They might be doing a sanitization of their cooling towers, draining their fountains and refilling their fountains back up. And tenants also want to think about this as well. If you have a Keurig machine, back to coffee again, if you have a Keurig machine, you want to flush out that line and flush your sinks and make sure that the water flows through as much as possible to prevent this. A lot of buildings are even going around and doing Legionella testing just to be safe. The CDC's put out a lot of guidance about this. People that have had COVID are more susceptible to Legionnaire's disease. So this is a huge concern right now. You also want to think about indoor air quality. The HVAC systems haven't been running as much. So a lot of folks are looking at their HVAC systems. They're trying to get more fresh air into the space as much as they can. And just like these spaces, you have to remember these HVAC systems are all different too. People are looking at things like UV light and deionization and things like that to try to create a more sanitized air. Some systems, there's just not room in the HVAC room to do this. So you have to look at that as well. And we're also using sanitizers that are a little more noxious than your typical green chemicals. So we're trying to flush out the air and the water in these spaces as much as possible. And you also have to remember the janitorial service hasn't been as high. And you couple that with more humidity in the air because the HVAC hasn't been running as much. You could have condensation issues and mold growth in different spaces where you didn't before, where furniture is pressed against the wall, below windows, around HVAC registers, things like that. So thorough inspection of the building is key here, and of your space. Someone could have just left a sandwich in their desk, and now you have this rotted food odor in your office. So inspecting and mitigating these issues as soon as possible is key here.
Yeah. So let's switch gears and move over to policy. Obviously, this is, expectations, it's guidelines, it's rules, enforcement. It's a lot to keep up with. So Mark, talk to us a little bit. How should employees be thinking about the policy side of all of this? What do we need to create as policy? What can be guidance? How do we start to think about this? Yeah, go ahead and hit your unmute. There you go.
So much of this actually just starts with policy. You know, in order to, as you reopen, you're going to be looking at, you know, first of all, it's going to be fact driven and it has to be kept current, and recognize that things are going to continue to change as this disease continues to metastasize or, you know, modify itself as it goes through the system right now versus the fall. So you want to be fact driven, and, you know, we want to take a look at also, you know, what is the nature of your business? Everybody's business is going to vary. And so, you know, you may have folks who are frontline workers, you may have folks who are office workers, you know, some of the facts and you're going to deal with is going to vary between those folks. But you want to start kind of essentially with having a policy that's fact driven, you know, at a minimum, you know, using the CDC guidelines, you know, the basic things you're talking about, you know, PPE, you know, social distancing, hand washing, education, publishing policies, and available not only for your employees, but for visitors as well. And for, you know, if you're in a situation where you have customers, either you're sending folks out to perform services or deliver things, or you have customers visiting your business, you want to have that visible as well. And you will have that consistently enforced. So that's kind of where you start. And that, you know, then, you know, we can talk about, you know, we've gone into the Rosslyn Ready product. We've talked about various things you can talk about for, you know, tailor it for restaurants, tailor it for offices, but, you know, it'll have to vary. And again, it has to be kept current too, you know, and maybe you need to consult an industrial hygienist for this. But, you know, we really think about early February, mid-February. You know, the CDC was at that point guiding that, you know, you didn't need masks. And now that seems, you know, completely silly. So we don't know what's going to continue to happen, but you got to have one. You got to have it published, and you got to keep it current.
Yeah. Jay, in our Rosslyn webinars, we talked quite a bit about customer expectation, and you have some interesting data that sort of talks about what people are going to expect is clean and sanitary. Like, that's the most important consideration right now. So talk to us about how the industry is responding to those public expectations in terms of setting new policies and procedures for their operator, you know, for their employees to follow.
Yeah, it's interesting. You know, 2.5 months ago, the number one reason people went to restaurants was flavor, taste, food, convenience. Right now, I think it's 43%. The reason that they would pick a restaurant in their neighborhood is they believe it's clean and sanitary. That's the number one reason right now for some data analytics that we've gotten. I mean, it's a very different way and different process of thinking about restaurants. And what we're advising our clients to do is to do what we're calling sanitation theater. Restaurants are very good because of the health department and the regulations of cleaning. They have to get good at disinfecting now, and they have to get good at sort of mitigation of all potential contaminants on everything that anybody touches. So it's a much, you know, more aggressive level, specifically in the front of the house with the wait staff. But we're also saying, you know, it needs to be visible. You need to wear your sanitation on your sleeve. It needs to be sanitation theater, if you will, and you know, where we show people cleaning. You know, restaurants were used to be embarrassed about cleaning tables and make it as quick as possible. Now it's a thing. You have to kind of wipe things down and and sanitize and make sure all the condiments are off and everything is clean. And so there's a whole different process, a whole different mindset. And we're recommending that people really, you know, lean into it and push it forward and share everything they're doing with their guests to make them feel comfortable, both in restaurants, also in hotels. Hotels is huge. So yeah, that's our strategy now. It's sort of this theatrical version of safety and sanitation.
Well, that's a great lead into the final area that we're going to talk about, and that's perception. And perception is important. And it's, you know, whether it's that customer coming back into the restaurant or whether it's an employee coming back to the office. So let's talk about a few things that we can do as employers to create a positive perception and kind of help inspire people to do their part. So Janet, you know, first of all, how do you know if your employees are ready to come back? And then if and when they are, how do you set the right tone so that they have a positive perception about the reentry and what you're doing to support them?
Well, I think there's a whole spectrum of readiness. You know, you've got, you probably have some employees that wanted to come back last week, and you've got others that may not want to come back until 3 months after the vaccine is proven to work, and everything in between. So there's not going to be a one size fits all, but you have to stop and think about who is essential to have back at the office And then why are they coming to the office? And that will help kind of guide what that perception is all about. You know, one of the things that we're finding even in our own survey that we just released last week is there's generational differences, and the younger generation have actually felt less productive at home and less satisfied with the work from home experience. And they're even more anxious to get back into the office. So, you know, you've got to set a tone, and I'm just going to build on what Mark talked about in terms of policy. You know, it starts with getting that policy out very early and making sure everybody understands the expectations that the employer is doing, but also the expectations they expect their staff to do. And it has to take a reassuring, you know, tone. It's got to be kind of a smooth and empathetic transition back to the office. So we're working with a number of clients that we're starting to develop like welcome back kits and starting that conversation very, very early with employees on what are they most concerned about and how do we address that head on. The survey I mentioned, we actually have a client version of that we use in our own offices, and we're using with our clients to understand, you know, how are their employees feeling? You know, what have they learned, and how are they working differently, even working from home, that we now want to transition back to the office and build on that momentum, but also understand their concerns and fears and make sure that we're addressing them head on right from the very beginning, because it's all about transparency. So starting that dialogue now and then reinforcing it as people are starting to come through makes a big difference. I mentioned the welcome back kind of packages, but there's also video tours that you may be able to do. You know, this is what to expect when you get back to the office, and walk them through how we're going to use the office, what's off limits, how we might want to use pantries differently, and all those things around what their experience is going to be like. You know, Jay, you were talking about the experience of getting back to a restaurant. And you know, we've been working or we have been creating meals at home, right? And we know we can do that. And we've got recipes that we can make amazing meals at home, but we crave that restaurant experience because of the camaraderie, because of trying something new and all the experience that goes along with eating in a restaurant. And I think the same is true for the office, which I think is kind of an interesting parallel as we've been talking about these two spaces. And so how can we start to create part of that excitement, but do it in a calm, reassuring way that even carries through into signage and other things that help reinforce the right behaviors?
Yeah, you know, Jay, it was interesting when you were talking about the sanitation theater and that notion that, you know, usually the cleaning was happening sort of quickly. I thought, Henry, the same thing goes on in the offices, right? Because like people are cleaning the office buildings after we're already gone. Like unless you're one of those late employees, you never see the cleaning team. So I'm curious from your perception or from your point of view with cleaning, how can you sort of use that to your advantage from a perception issue?
Yeah, I mean, the most important thing is that they're doing a good job and things look clean. We've seen some folks doing this thing where they're actually putting like these checklists. So they're having their janitorial service post these on doors, or maybe they're dropping them off in conference rooms or pantry areas after they clean, just to kind of reassure people that yes, this was cleaned, like, because they don't know, they weren't there to see it. So we've seen that done. Yeah, and just having the signage and having stations and encouraging that policy over and over again is that's going to make people feel comfortable.
Yeah, we're actually taking a same tactic with our ambassador team, which are our frontline hospitality team out in the field. And Henry has actually helped to create a cleaning protocol that they're going to be using for all of the public realm, public space furniture. And that's an important thing, is seeing someone in a uniform who's been properly trained and certified to be doing that cleaning. So we have actually a lot of great questions that are queuing up. So I'm going to go ahead and start jumping into those. And encourage you, if you've got questions, go ahead and put them in the Q&A function. And it looks like we had maybe an incorrect link for the toolkit. I think Najia and the great team at Board of Trade are straightening that out. So hopefully we have a corrected link up there for you. So first question for you, Mark. What if an employee has someone in their house who's a frontline worker? Should that employee remain working from home so that they don't bring that to the office?
Yeah, I think, I think what we talked about earlier, you have to have this individually tailored, and you have to kind of try and take a collaborative approach to this. First thing I would look at is, first of all, talk to the employee. What is the employee's preference? If the employee was someone who preferred not to work at home and there's not a need to have preferred not to work in the office, and there's not a need to have that person in the office at this time, then it might be best to just go ahead and agree that that person will work from home. What you don't want to do, though, is get yourself in a situation just because that person's the other person in their house would be a frontline worker, healthcare worker, someone like that, to go ahead and say automatically, no, you're not allowed to come into the office like that. We don't want any blanket kind of prohibitions on that. You want to just have a kind of very fact-informed approach to this. And so, that's the way I'd look at it there. And then the second consideration is, what if this person is essential? If this person is essential, what is the ways we can either A, continue to allow them to work, come into the office and, observe his protocols that help keep him safe, that person safe, and, the other employees safe, or is it just a matter of, just treating that person, presumably their family member who is a frontline worker, is doing what they need to do in terms of, keeping themselves safe, and just like everybody else, showing up and unplugging, showing up and, testing their temperature when they get home and when they get in the office, and, treating them just like every other employee. That's the way I would probably handle it,
Yeah. And do you have any examples? Another question was, do we have any examples of what a policy looks like? I mean, I know we actually created sort of a draft policy for our office. What's the recommendation there?
I mean, I think you could, if you want to contact us, we can obviously show you examples of it. There are examples, looking at, and again, every policy is going to be, vary depending on the nature of your business. And every business is almost individual. Looking at, what you're going to be finding with particular employees, if it's, office workers, the basic, at least the basic things that CDC requires, personal protective equipment, social distancing, washing your hands, and, publishing this. And, as Jay mentioned, kind of the theater of social, taking the necessary steps there. You can find those policies. I'm happy to provide copies of them, and then if you're dealing with a situation where, like, you're having lots of customers come in, it's taking that and then, kind of amping it up a little bit. How are we going to advertise this to make sure visitors abide by our policies? Maybe it's, having the policies published out front. Maybe it's having someone up there, going ahead and, providing temperature taking when they get in, but providing that, published up front, and, again, keeping them updated too, because this situation will change over time. We have examples of it right there on the Rosslyn BID, Rosslyn Ready, and, you can customize it from there.
Yeah, and I think that is the most important thing. And all of our conversations, we've done these webinars several times now for our Rosslyn businesses. And that's one of the things that each of you has said in your respective areas, is that you have to keep up with the advice because it is changing. And in fact, one of the questions that we have is, are you all aware of inspection protocols in Maryland, DC, or Virginia? Will state health agencies be inspecting restaurants, doctors' offices, physical therapy places, those types of things? And I think that kind of gets at that. So I don't know, either Jay or Henry, if you want to, or Janet, anybody has an answer for that one?
I haven't heard that this is going to happen at this point. I think they're a little busy right now. I could see it, if it is going to happen, it'll start in high-risk areas like doctors' offices, hospitals, things like that. But at this time, we have not heard that that's going to take place.
Oh, Jay, your mic.
The only thing that we've heard on the restaurant front is that, as people go out into outdoor seating, there does need to be a reinspection sometimes for that, or an approval from either the health department or the local, alcohol board. And so there is a component of that, but we don't think anybody's being incredibly difficult about it, because the guidelines and standards for dealing with this, the virus far exceeds anything the health department has asked of anyone in the restaurant business so far. So I think that they're scrambling to, understand what they need to require people to do. And once we see that, I do think you're going to see very clear health inspections, and I think there's going to be a call for that.
Yeah. And I think that's right. That's what we're seeing in Arlington, is they're really starting to work through and triage what the issues are as we begin that reopening, particularly for those front-facing, customer-facing locations. So a question came in for you, Henry. What recommendations do you have for sanitizing technology? So laptops, copiers, conference phones that might be damaged by traditional sanitizing agents?
Yeah, that can be very tricky, and I'm not going to go past my expertise here. You definitely want to check with either your manufacturer or the distributor of this stuff to see if they have recommendations for that. It's very important to de-energize it, de-energize any kind of electronics if you're going to be sanitizing it. Obviously, wipes and just less fluid is more useful. There's also professional electronic remediation firms. You can try to source information from them on how to do that, because it can be tricky. Obviously, like a phone with holes in it, how do you get in there to ensure that it's 100% clean? It can be tricky. So I would refer you to either the manufacturer, distributor, or professional electronics remediation contractor if you have questions about that.
Okay, great. Question for you, Janet. So when you're thinking about working through your space, do you have to have a specific, is there a specific calculation to figure out like how many employees you have, how much space they need? How do you do that calculation?
Well, there's not a specific calculation. You really want to look at how people move throughout the space, and can you start to create a bubble around each person, and as they pass or as they sit or as you sit around a conference table, that bubble is maintained. And that's per the CDC guidelines. I think the distance of that bubble keeps kind of changing. So, err on the side of caution. But trying to increase the social distancing is really not just where you sit, but how you move throughout the space in terms of queuing, in terms of, passing people in and out the restrooms, the pantries, getting coffee, and the like throughout the whole space.
Yeah, it is it's a holistic thing. And Jay, I would imagine you're seeing probably the same thing on the restaurant front as well. I mean, you've got the back of house, the front of house. Oh, your mic.
Sorry, I have a noisy French bulldog. For the restaurants, the issues that we're having is really not in training the staff and what to do. We're dealing with a whole sort of spectrum of guests that some of them don't care about social distancing and some of them are terrified. And so, as from a policy perspective, we're recommending people be a little bit more draconian in turning people away who don't want to play ball, and being a little bit more difficult about those kinds of, enforcing the safety and sanitation, because it will make the broader spectrum of guests feel more comfortable and feel like the business is taking it seriously. The second that, people just wandering around doing whatever they want to do and not caring for other people in your establishment, people aren't going to come back. And so we're being a little bit more aggressive from a policy perspective. This is very different from what Mark is talking about from a legal perspective. But, we see a lot of restaurants, specifically in Asia that we're working with in Hong Kong. They turn 55 to 100 people away at night because they don't want to play ball, and their customers appreciate that. And I think that's a good, stance to take.
Yeah. So question for Mark, does every business need a COVID policy?
I'm also having dog issues here too as well.
We should actually, I think on all these Zoom webinars, we should actually count the number of times someone says, oh, your mic's not on.
It's amazing. I've got Amazon and the forces of evil delivering something next door right now, and I've got all kinds of dog noises going on. Yeah, should yes, I think you should. And I think it can be as simple as just, depending on the size of your business, it can be as simple as something very, literally, adopt by CDC guidelines, requiring people to disclose, if they're exhibiting symptoms or they've been exposed. This does not have to be a robust policy, but it needs to be something that you do have, so which you can either hold people accountable to, or which you can effectively administer if you're facing challenges with someone who may or may not be abiding by, the requirements you need to keep, frankly, your customers safe, keep your employees safe, and keep your reputation, particularly in the context of something that's very visible, like a restaurant or something like that. So I think you should have something like that, yeah.
Yeah. And what about temperature checks? Should you require them? And if so, what's the setting? What's the guidelines?
You should, and that basically because it's something that's kind of recommended by the CDC, and that's an easy thing to do. But also the manner in which you're doing it too. I mean, you basically just get like a thermal scan, something where you can just go ahead and scan people on the forehead or something like that. You don't want to get anything beyond, essentially just simple like that. That's kind of an industry standard. We talk about, some of the concerns you have, and I've seen some of the comments here about liability and stuff. You want to be seen as, and you want to be actually doing what is appropriate under the circumstances. That is something that's widespread and, wouldn't be considered as intrusive or, invasive or out of line. And so I think you should have that, and it's an easy way, frankly, to distinguish for the people who are either exhibiting symptoms or not exhibiting symptoms, recognizing, of course, that this disease is such something that, where people can be asymptomatic for a couple of weeks too, but it's an easy thing to do and, accepted, I would view it.
Yeah. So there's a question here for you, Janet, and I'm curious too, Henry, what you're seeing on the building side of this. What's the future of door handles? Will we see more automatic doors in building design? And I think this is actually such an interesting question, because when you talk about sort of touchless, items, I think we'll probably see a lot more of that both within the office design as well as the building. So maybe if you guys can kind of comment on that.
Sure. We are starting to see, as we're starting to think about the next generation of buildings that are going to be very equipped from a technology standpoint. It might be voice recognition, facial recognition, motion sensors, that anticipate your move. It could scan your face. It becomes your badge. It lets you in the door. It knows where your meeting is going to be on what floor, and may take you in the elevator straight to that floor based on your calendar. So I think it's a pretty exciting time in the terms of building design, as we're starting to think through what is possible and how do we create a completely touchless experience from essentially the sidewalk all the way to your first meeting of the day, which is pretty exciting. So I think we're starting to see quite a lot of that already. And remember, you've got ADA doors, for building entry doors right now in most buildings in the district, and being able to hit those with your elbow and walking in is one less door to touch right there.
Yeah. We've seen that on the restaurants too, Jay, I think, where people are propping open the doors so you can just kind of sneak on through.
Our data, the analytics say that 78% of the people are afraid of touching the door handles going into a restaurant. 78% of the people are worried about it. They're worried. It's like a minefield, everything in there, going to the restroom, all of that.
The menu.
The menus.
I've never liked touching menus, and I'm not a germaphobe, but the menus have always grossed me out.
Well, they're probably going away and becoming digital, which is, probably good for everyone. But, we're seeing things like those little kick plates and, foot door openers and stuff like that. I mean, I think you're going to see all of that coming in, and, touchless water, fixtures and air, dryers and all of that stuff is going to, come back in. So. Yeah.
Henry, what are you seeing in terms of the property owners?
Well, there's always a cost associated with this. So it kind of depends on their budgeting right now. We're seeing a lot of interesting things with foot doors, like Jay was saying, and propping doors open for restrooms where, they don't have an automatic door for a restroom. It's jumping off a lot.
Yeah. And I am curious. So Jay, you mentioned a couple of things like the kick plates. What about, like the payment systems and like ordering for the restaurants, all these different apps? What are the other technology? And I know you actually have a full section in your Rosslyn Toolkit that talks about technology and sort of how operators can really pivot. So what are some of the things that you're seeing there on the technology front?
So we're seeing the QR codes for not only menus, but also payment. There's a new technology that you can do, remote payment. I think the Apple Pay and all of those sort of, digital touchless payments. We're seeing table side where you can swipe your own credit card, sanitize your hands, swipe your own credit card, handle the whole transaction by yourself. You don't have to wait for a waiter to take it somewhere in some back room and come back to you. And I also think that there's going to be a lot more around reservations. Waiting is not a thing you can do anymore. You can't wait in a crowded room to get your table. So we're going to see much more reservations. Someone brought up a question about, should people be lingering at a table? For any of you on the call, or anyone that or your friends and relatives, please no. These restaurants are having a hard enough time, but people staying an extra 20 minutes beyond the standard dinner time is going to create a waiting, and people are going to be out in the cold or out in the rain just waiting to get somewhere near the restaurant. So I think all of these technologies you're gonna see a lot more high tech, lower touch, specifically as it relates to reservations, timing, pre-ordering, all of that.
Yeah.
And I'll just add that we're already starting to see that in a lot of the large airports. That you can order food, you could have it delivered to your gate. You're doing it all by iPad. You're not touching a thing, and you're paying online. And so I suspect that a lot of those technologies that are proving they can work well in airports and kind of high traffic areas will start to proliferate.
Yep.
Yeah. So another question, according to which organizations and/or policy is it allowed to require employees to use PPE in the workplace and/or adhere to social distancing? So Mark?
The CDC is basically, people are going to be guiding themselves off, you're looking for fact-based empirical thing. And the basic thing, is CDC. Everything kind of revolves around that. You get requirements for PPE, you get requirements for social distancing, requirements for education, requirements for, constant hand washing, cleaning of common areas, commonly used tools, commonly used equipment. That's all part of the basic guidelines of CDC. And that is, kind of where it all begins. And so that applies whether you're in a cashier situation or you're at a office situation. And so, but then you have to then think about beyond that. If you're in a situation where you have more exposure, if you're a receptionist, is it okay to maybe, I've seen things where we've had people put almost like a sneeze guard, a plastic sheet down there to protect the receptionists who are dealing with the public constantly coming in. But these are all basically founded initially begins with the CDC and then really kind of goes out there depending on what the facts are driven by your industry and your business.
Yep, that makes sense. So a great question, and I'll throw this out to the panel because I think this is such an important topic. We talk a lot about regionalism here in this area. Obviously, Board of Trade has done some amazing work in this regard. When we were in the Amazon hunt, that really brought to the fore how important it is that we act regionally. And so when you're dealing with a health crisis and an economic disaster like what we have, obviously acting regionally is critically important. So can you share your thoughts about the balance between consistent policies across jurisdictions and states and the need to tailor precautions to the health conditions in a locality? And how would you characterize collaboration on these issues in the greater DC region? It's a big question.
Oh, Lord. We're working in Rosslyn, Montgomery County, and DC, and it would be great if they were all the same. Even broader Maryland and Montgomery County are different. They're all about the same stuff and about the same strategy, at least on the restaurant front. It's very somewhat consistent. I think the percentages of what you can do inside and outside are different in DC than they are in Maryland, but they're all at different time frames. They're all at different sort of very specific requirements. And it's very maddening if you have 5-10 locations in different parts of the DC metro area. You have to have 10 different strategies, 3 different strategies, or 4 different strategies. So it's very tricky to do that right now. And we haven't seen an ongoing, and maybe there is, and I haven't seen it, but it doesn't seem like everyone's on the same page. And I think everyone's dealing with their local micro municipalities and micro needs rather than looking at this as a macro.
I have probably a different viewpoint because we're working with a lot of national and international firms. In fact, we're a global firm with 50 offices. And so we're looking at it from maybe the local starts to determine the timing and phasing and, the level of risk. But a lot of the policies we're trying to do at least by country so that as people move around, as we're working as a single organization, that we're all marching to the beat of the same drum, if you will, in terms of policy and expectations and the like, so that we don't regionalize it so much that you kind of forget that this applies to this office and this location has a different rules and regulations. So we're looking at it far more as a one firm in terms of what is really important and trying to create consistency. And many of the clients that we're working with that are more national or international are doing a similar matter.
Henry?
Yeah, I would just add, as far as policies and following regulations, it's always important, whether you're looking at a local, state, or federal regulation, to follow whichever one is the most stringent.
Exactly.
Yeah, that's great advice. Mark, anything else to add?
Now, I mean, I saw a question there regarding liability and, how that might impact things. And I wanted to kind of respond to that with two global observations. One, is there a safe harbor law out there right now that kind of protects and insulates everybody? And there isn't. I know there's been discussions both at the congressional level and at various state levels about enacting something like that, but there isn't. And the other observation is just, recognizing, people being concerned about liability for visitors, employees getting COVID-19. That's a process by which you'd have to kind of prove how you got it and and at a time when we're really struggling with contact tracing. I'll give you a quick example. This weekend, we went to our favorite restaurant in Old Town, which is opening just for pickup. They did a great job, with the PPE and published the stuff, and everything was hermetically packaged. And we parked 3 blocks away, and we walked right down the street where Old Town had closed down the streets and was doing the outside, sitting. And we got our food, and we walked back right through the public like that, got back in the car, drove right over to the gas station, got the first gas we've gotten in 2 months, grabbed that same handle that everybody else has been grabbing, tanked up the car, and headed home. Now you tell me if we come down with it, where do we get it? That's the biggest challenge you have there. So you got to think about in terms of what are the legal standards you have. 2 things you want to think about. One is kind of OSHA. OSHA requires, that you have to have a workplace environment that's reasonably safe to prevent people from death or in serious harm. And then you also, you have people coming on your site, you have premises liability. And I'll just speak from Virginia, but it's basically most of the same thing. But you have to have facilities and properties, where people are coming on board, they have to be reasonably safe from harm. Again, it's kind of largely the same standard. So the question really boils down to what is reasonably safe, and what is reasonably safe in a really unprecedented circumstances like this. And you just think from our discussion here, so many different standards you can have, so many different factual scenarios involving each person's property. The question becomes, at least the base reasonable thing is what we know from empirically driven research put out by the CDC. And so that's where I say you come back with a policy, at least begin with the CDC guidelines, but then consistently keep up with it, change it as necessary depending on the facts. And as Janet pointed out, I have local clients, I have national clients. They have some facilities that are great in areas that are not having hardly any impact at all, some that are significantly impacted. You have to just kind of use that exercise of reasonable discretion based on the facts that you have. And that could be even an area where you don't have much impact right now, but God forbid you had an employee come down with it. Well, that's going to obviously change the fact of how you're operating right now, or you have a visitor comes in with it. And that's why we have these policies. That's why I turn to this screening mechanism. I get a lot of comments about these things being some people thinking that they are kind of blown out of proportion, and they're not, but it boils down to how you're conducting yourself in a reasonable fashion, dealing with frankly unreasonable circumstances.
Yeah. So that's a great place, I think, to leave it. Thank you all. It's been a pleasure working with you to create this program. You've been amazing at giving all of our businesses, not only in Rosslyn, but across the DMV, some great advice. And really that was the intentionality for this program, is that we wanted to create something that would help give people that guidance and at least give them some place to start and some resources to think about, so that reopening our region wouldn't feel quite so daunting. So thank you to Jack and the Board of Trade for having us. It's been great.
Well, it's been great having you with us. So Mary Claire, thank you. I think this is a really great program, and really appreciate your wanting to share that across the region. So Janet, Jay, and Mark and Henry, thank you for all that you've done to help pull this together and for sharing it with us today. I know we ran out of time and there's a few more questions, so please go to the site, log in, see if you can get your questions answered there. If not, let the folks at the Rosslyn BID know, and they stand ready to help. Mary Claire, I know we'll continue to work together, and if there's anything that we can do, let us know. Our challenges are mounting by the day. But we will figure out how to work through that. And we have some real opportunities here. It's there is light at the end of the tunnel, and we'll work through this. And I'm confident we're going to come out with a much more resilient, equitable, and strong economy in this region. But it's going to take us some time and effort to do it. All right. So thank you, everybody. I appreciate that. Again, this will be available on our website for folks to check out later this week. And with that, everybody stay well. And thank you for joining us today.
Thank you.
Thank you.
Thanks for having us.
Okay, great.
Bye, everyone.
Good luck, everybody.
Stay safe.